What is the best strategy for performing high-quality CPR on a patient with an advanced airway in place? A. Provide compressions and ventilations with a 15:2 ratio. B. Provide compressions and ventilations with a 30:2 ratio. C. Provide a single ventilation every 6 seconds during the compression pause. D. Provide continuous chest compressions without pauses and 10 ventilations per minute. Correct answer, option D. 12. 3 minutes after witnessing a cardiac arrest, one member of your team inserts an endotracheal tube while another performs continuous chest compressions. During subsequent ventilation, you notice the presence of a waveform on the capnography screen and a PT-CO level of 8 millimeters of mercury. What is the significance of this finding? A. Chest compressions may not be effective. B. The endotracheal tube is no longer in the trachea. C. The patient meets the criteria for termination of efforts. D. The team is ventilating the patient too often, hyperventilation. Correct answer, option A. 13. The use of quantitative capnography in intubated patients. A. Allows for monitoring of CPR quality. B. Measures oxygen levels at the alveoli level. C. Determines inspired carbon dioxide relating to cardiac output. D. Detects electrolyte abnormalities early in code management. Correct answer, option A. 14. For the past 25 minutes, an EMS crew has attempted resuscitation of a patient who originally presented in ventricular fibrillation. After the first shock, the ECG screen displayed asystole, which has persisted despite 2 doses of epinephrine, a fluid bolus, and high-quality CPR. What is your next treatment? A. Apply a transcutaneous pacemaker. B. Administer 1 milligram of intravenous atropine. C. Administer 40 units of intravenous vasopressin. D. Consider terminating resuscitative efforts after consulting medical control. Correct answer, option D. 15. Which is a safe and effective practice within the defibrillation sequence? A. Stop chest compressions as you charge the defibrillator. B. Be sure oxygen is not blowing over the patient's chest during the shock. C. Assess for the presence of a pulse immediately after the shock. D. Commandingly announce clear after you deliver the defibrillation shock. Correct answer, option B. 16. During your assessment, your patient suddenly loses consciousness. After calling for help and determining that the patient is not breathing, you are unsure whether the patient has a pulse. What is your next action? A. Leave and get an AED. B. Begin chest compressions. C. Deliver 2 quick ventilations. D. Check the patient's mouth for the presence of a foreign body. Correct answer, option B. 17. What is an advantage of using hands-free defibrillation pads instead of defibrillation paddles? A. Hands-free pads deliver more energy than paddles. B. Hands-free pads increase electrical arc. C. Hands-free pads allow for a more rapid defibrillation. D. Hands-free pads have universal adapters that can work with any machine. Correct answer, option C. 18. What action is recommended to help minimize interruptions in chest compressions during CPR? A. Continue CPR while charging the defibrillator. B. Perform pulse checks immediately after defibrillation. C. Administer IV medications only when delivering breaths. D. Continue to use an AED even after the arrival of a manual defibrillator. Correct answer option A. 19. Which action is included in the BLS survey? A. Early defibrillation. B. Advanced airway management. C. Rapid medication administration. D. Preparation for therapeutic hypothermia. Correct answer option A. 20. Which drug and dose are recommended for the management of a patient in refractory ventricular fibrillation? A. Atropine 2 mg. B. Amiodarone 300 mg. C. Vasopressin 1 mg per kilogram. D. Dopamine 2 mg per kilogram per minute.